anyone on here has inquired, my name should look familiar. Now you can see my face behind my email. So welcome to the webinar on this info session. This is being recorded, so also, and these slides are available. So don't think that you have to, take pictures of any slides or hurry up and take any notes on anything. All of this information can be available to you after we're done. And the question and answer box is live. So if anytime throughout the presentation you spark up a question and it happens to be on that slide, go ahead and put it in the question and answer box. You may get a message from me saying we're going to answer this live, or it's coming up in the presentation. One of us may just answer the question for you, but we will make sure that all questions are answered either throughout, or we have plenty of time at the end to open it up to general questions. So with that, I am Amy. I am going to let Dr. Sina introduce himself, and then our two wonderful first-year students that are going to help us along this journey, and then we'll go ahead and get started. Oh, we got you on mute.
That's how we start things.
I did that last time, so it's okay.
So my name is Steve Sina. I'm a faculty member at NISA. I teach mostly the integrative pain management. I also supervise clinic, and I am the faculty advisor to the doctoral program. So there's just lots of things we could talk about. I have a history of doing research and working with sport teams and running my private practice. So yeah, lots to talk about. I'll send it off to Emma.
Hi, everyone. I'm Emma. I'm a first-year student at NISA, and I just a couple weeks ago started my year. Really loving it, and I'm looking forward to answering all of your questions.
All right, and hi everyone, my name is Sam. I am also a first-year student here at NISA with Emma. So yeah, we just started our second semester a few weeks ago. We're having a great time. We've started our assistantship, which is something we can definitely talk about as well. So we're shadowing real practitioners, and it's just been really fun, enjoying it a lot.
Great. All right, let me bring up this PowerPoint. We can go ahead and get started. Okay. So if you didn't want to chat about NISA or MCPHS, you were in the wrong webinar, but we're really glad that everyone is here. A little bit about kind of MCPHS, where do we come from, what's happening. First and foremost, you can tell by our name, we were first and foremost a pharmacy school, and now we arrange over 100 different comprehensive healthcare and health science programs. So we have been around now for over 200 years. We're celebrating our bicentennial. We're also going to talk a little bit about that NISA is celebrating 50 years this year. So being the oldest acupuncture school in the United States with the second oldest pharmacy school in the United States has been a really great relationship, which we will get into a little bit more detail. So being in healthcare, first of all, is a great step. Employment in healthcare is on the rise. We're seeing even a lot more interest in a lot of our healthcare programs in the past 2 years. So a lot more nursing students. We have a lot more acupuncture students, which is great. So we're even seeing it on the academic level that more people are interested, and we're also seeing that, employment is needed. So those are all really good signs for us being interested in healthcare. Our students come from all around the world. So I've had the privilege of working in international admissions and traveling internationally for MCPHS. And some places that I have been, first of all, didn't necessarily know they existed because I'm terrible at geography, but also never would have known that they would know where I was coming from. And you walk into any pharmacy in any country all over the world, you will at least see the name probably of MCPHS. So being a part of this university also stretches a very vast alumni network and stretches all around the world. Also leads to a lot of different clinical affiliations that MCPHS has in general. So we have our Boston campus, even though it's a lot of undergraduate programs, but MCPHS is MCPHS. So if a Boston student was really interested in a clinical rotation out here in Worcester in the UMass system, that is open to them because it's an MCPHS site. just like if any student on the Worcester campus, if there was a clinical site open for that rotation in any one of the hospitals in Boston, you would have just as much of a chance going to those locations. It doesn't matter which campus you're housed on. So sometimes I do kind of get those questions in terms of, well, which campus is better? And everything is really great, and all these opportunities are available to you no matter which campus you're attending. So a little bit about, we talked a little bit about the history. We talked a little bit about MCPHS. Let's talk a little bit about Worcester. So in Worcester, we are the second largest city in New England. I've had the privilege of living in Worcester now for almost 20 years. I used to like it when I would be like, oh, I've been here for 8 years, not too long yet. And then all of a sudden the years start adding on. But since I have been here for a little while, I had the privilege of watching the transformation of downtown Worcester when MCPHS came into town. So I got to see the transformation, that they were historically preserving a lot of buildings, that they were being really careful with preserving the history of downtown Worcester and what they're calling their buildings and who they're calling them after. So we have a very big footprint here in the city of Worcester. And one of that adds to that big footprint is actually the School of Acupuncture, because we have a community clinic that serves the local population that has an extensive wait list. We're even telling Emma, I know that you were just recommending this to a student visiting the other day. You get that admit letter, call up the clinic and put your name on a waiting list. Because by the time you get here, maybe you'll be up for a series of appointments. So it's very, very popular here in Worcester. So we have a lot that goes on in terms of activities in restaurants and student groups within the school, social student groups outside of the school. So a lot going on there. I will say, I'm going to kick this off with my favorite thing about Worcester in terms of being a resident, even though I'm not a student, is I feel like I can find every cuisine within Worcester. Like I feel like whatever I might be in the mood for, I can find an outlet that is serving that type of food. But that's also like how I like to travel, is where's the food, where's the wine, I want to taste all the things. But I'm going to ask our students, Sam, I'm going to start with you. What would you say your favorite thing about studying here in Worcester is?
So I think one of the best things about studying in Worcester is how many grad and schools there are, how many programs there are here in Worcester. So there's the UChan Medical School, there's MCPHS, there are all the universities like WPI, Clark, Quinsig also. So we just have a lot going on in the city. So it's a very vibrant downtown when everyone is working and in session in class. So it feels really fun to be in a major city with a lot of different campuses. So you never really feel like you're out here just on an island. You feel very connected, and it's close to Boston as well, which also has great universities. So I think the student-centered vibe of the city is really fun and interesting, and something I wasn't expecting when I moved out here. I used to live in Boston, but I've been very pleasantly surprised about that.
Emma, I know you guys are trying to manage mute and not have an echo.
Yeah, I know. I piggybacking off of a lot of what Sam said. I had a friend at Clark before I was even interested in attending NISA, and her and I were able to meet up and have lunch a couple of times last semester, which was great. And I think Worcester is a well-kept secret. Like I got here and I was like, hang on, there's a lot going on here. There's tons of great restaurants, and they're all like, you can like throw a rock and hit a good restaurant outside of the NISA campus, which is super helpful because, there's tons of options for like bringing your lunch and lots of places to keep your lunch cold here. But there's also like, if you're like just not feeling it, there's really easy places to go and get something good. And it's a nice little treat and break in the day to go get something really close to campus. But yeah, I've loved Worcester so far.
Great. Well, Worcester loves you too, so we're happy for sure. And I will say there is Courthouse Cafe on Main Street, and they serve breakfast all day. And I think along with Hidden Gems, that is also one. You can get pancakes at 2 o'clock in the afternoon, and they're awesome. So just in case that's something that appeals to you. So also one big benefit of being here on the Worcester campus is that we have housing available. And this housing is, when you think about college housing, I mean, you think about, the traditional dorm and bunk beds and all of those nightmares, that we had in our previous lives. This is an all graduate professional campus. So this means that we have apartment style, we have condo style, we have single living style. So we have our Lincoln Square building that has hotel room style. So they're single units, there's a community kitchen. We also have single studio style. So lots of different options for different budgets, also different amenities. So how important is a kitchen to you versus, is the cost most important, or is it the walk to class the most important? Whatever's in your criteria, I feel like we generally can meet. But for this, I'm gonna let the students chat a little bit about campus life and living on campus. Emma, I believe, are you living in Lincoln? I thought you were living on campus.
Nope, not
do you-
me.
Okay, sorry. We also had two Emmas that I was confusing for the first 4 months of school. But you guys both probably have friends on campus. Anything you might want to add in terms of convenience of living on campus and those kinds of options?
So I can start by saying, I think a good percentage of our cohort lives on campus, more than I was thinking, because, usually a professional program, it's people with their houses that, are sort of commuting to campus. But everybody that is in our cohort that lives on campus has said great things about it. It's super helpful when you're doing clinical rotations to be close by to the clinic. And I think a lot of them had that benefit last semester when, we were observing at clinic and they could pick Saturday hours, or, hours that other people were not on campus. And so they had more options in terms of what they were able to observe, different styles, herbal program, that kind of thing. So, and then, we kind of got a taste of it. We got put in a different building for one of our classes, and the students who lived there had to let everybody up at one point. And it was like this beautiful, conference room that people who didn't live on campus didn't know about. And all the people who lived in the building were like, oh yeah, we're down here all the time. There was big flat screen TVs everywhere and like a little kitchen. And so it was, it's like, man, you guys have like a great spot up here, but none of us could get into it except for the people that lived there. So it was
Well,
cool to see that.
lots of benefits there.
Yeah.
This is actually a great time that chimed in that we just got our first question asking about safety on campus and walking into your dorms, maybe late at night. I will say, if you are commuting to campus, the majority of our commuter parking is down by our Lincoln Square building, which is right next to the Worcester Police Station. So if you are actually walking anywhere from the commuter lot all the way down to Norwich Street, where the acupuncture building is, you are actually on constant surveillance. And MCPHS actually has access to this city surveillance. So we do work in tandem, our public safety with Worcester Police. So if you're walking in between our buildings, you're either hitting the police station, the courthouse, major hotels, major convention center. So everything is kind of 24/7 camera and surveillance, I would like to say. So that's also very helpful. Downtown is, even though we say downtown, you think like that's where things are happening. It's not. 5 o'clock rolls around and like tumbleweeds could start like rolling down Main Street because there's not a whole lot going on, which is great because there's not a whole lot going on. It's quiet, it's easy to walk around, get to and from. But I know that I've been working here a long time. I've been walking back and forth and up and down this campus late at night, early in the morning, working late hours, and I've never had any issues. We do have the blue light system on campus, so we do have those locations and 24/7 public safety. Sam, Emma, anything you guys may want to add in terms of, you guys have been here for a full semester on campus?
Yeah, so I live actually like 7 minutes from campus walking. So I do live downtown and I'm not in an on-campus apartment, but I'm very close. And I've never felt unsafe, which I think is huge in the almost a full year that I've been living here. It's just like any other city, you just have to be on your guard if you're going to be out alone. So, walking at night, you just want to be aware and vigilant, but I've never felt more unsafe than I did in any other city, if that makes sense. And we're very close to campus if you do live on campus or if you live downtown. So there are constantly people out and about coming to and from work, coming to and from clinic, things like that. So you see people out all the time. It's never like a ghost town in downtown Worcester. There are things going on, which is nice. It feels like it's lively. There are people out. I've gone on some walks as the sun is setting, and I never feel like, oh, I shouldn't be out here at this time. So I always feel safe. And then just speaking to the living on or near campus part of this, I did just want to add, I know one of our classmates does live in the Salisbury housing, which is more of the apartment style, a little bit further from our building, but still an on-campus housing option. And she lives with a PA student. So this is also a really great opportunity if you want to meet some more people who go to MCPHS and do some informal interprofessional mingling, I guess. You can like live with someone who works in a different program and is going to be maybe working in the same hospital as you or something like that. So that's a really cool thing that she gets to have a roommate that now gets to be exposed to acupuncture and learn about that. She gets to learn about the PA system here. And it's just a cool option to like meet new people in the greater MCPHS community if you do choose to live on campus. I know my building also, I have some like dental students who live in my building too. So we're all over the place in Worcester. It's nice.
I was gonna say, throw a rock from any building. If you live in that building, I'm sure another MCPHS student lives in that building too, which is great. Which is a great introduction to our next slide, talking about all the different programs we have here on campus. So first and foremost, since we start with A and we're the best anyway, we're there on top for acupuncture. On the Worcester campus, we also have a lot of other disciplines that students are studying. So you are maybe having lunch with these students, you are maybe living with these other students. One great thing, and when everyone asks me, they come in, well, why your school? Tell me, sell me, what is the big benefit? And we always talk about, well, we're a health science institution, we're all healthcare programs. And then I remember one day someone was like, okay, yeah, that's great, but you didn't answer my question. What does that do for me? And I was like, yeah, you're right. I didn't really answer your question that well. And what it does for you, if you take all of these programs and you have them all on one campus, we actually force you all to work together, which is something that leads us to interprofessional education. So the idea of IPE is really that benefit of health science and healthcare in society. So acupuncture students are working with PT students and optometry students and dental hygiene students and PA students and nursing students, and everyone is involved in our healthcare, but everyone plays a different role. But healthcare is not siloed anymore. Not everyone, you don't just go to work, play your individual role, and don't worry about where your patient's going next because they're going to the different role. Everyone is really working together now, especially in the area of acupuncture. We're starting to see this come up in more clinical settings and more shared environments. So interprofessional education is the goal is really to make you the most successful clinical practitioner that you can be. So the more you know about where your patients are going and how they're getting treated by these other professions, the more helpful you can be for them. So Sam and Emma, you have had your first IPE experiences, and we're very lucky that Dr. Sina also advises on IPE. So Sam and Emma, I'm going to let you guys chat about what you've done so far. And Dr. Sina, I'm going to have you kind of talk about your experience from the long term and the benefits of IPE. So Emma, you want to start, or actually
Yeah, so we had our first IPE event last fall. It was sort of case study day where we went over a few different case studies of patients. And then you would be put into groups with all the different practices that are here at MCPHS, and you would each contribute how your practice could help treat this patient. So it was really a collaboration of, if this patient went to all these different doctors, how would each one contribute to treating the patient, which was really cool. You learn a lot about your own practice. So we had to do some work on finding out, what can acupuncturists actually do? What are they not able to do? And then you learn a lot about what the other practices could do. So something that I learned that I still remember is that I think optometrists are one of the first people who can diagnose diabetes. Like, you can see it in the eyes, which I had no idea, which is so cool. So you just learn a lot, and then you start to build these relationships with people here that hopefully will help you communicate with different practitioners in the future when you're out in your practice working, maybe in a hospital or maybe just in private practice.
Yeah, to build on that, if you're heading into, I think when I was starting to decide that this was the road I wanted to go down, I had no idea that we could work in hospitals. I had no idea that hospitals were hiring acupuncturists, that there were internship opportunities at hospitals, the VA clinic, things like that. And now knowing that, it really interests me. You know, there's a really great opportunity with a NISA alum at the in Cleveland. Cleveland Clinic. And you know, it's like to be able to work at like one of the best hospitals in the world would be, you know, really incredible. And it's something that if you're heading into, you know, I think alternative medicine, I think it's shifting, because I think at some point it's not going to be so alternative anymore. But to head into that and to feel like you could work at a Western institution is really cool. And so these interprofessional events really prepare you for how you'll be received at those institutions, especially as the program is getting rolled out, and how to sort of deal with, you know, I think for me, the surprise was, you know, I think a lot of acupuncture students go into them kind of a little bit defensive, just like ready to answer questions as much as possible because there's a lack of understanding generally. But for me, I was shocked by the amount of just really pure curiosity. You know, at one point, Dr. Sina mentioned how deep tibial needling can help with bladder retention issues. And the PA student next to me said, "Really? How does that work?" And I'm like, give me 3 years and I will give you a more detailed answer to that. But for now, you can do your own research on it because I'm sure there's lots of papers on it. But so the fact that a PA student was like, turned to me and said, "How does that work? That would be fantastic in the settings I've worked in," was really interesting and cool. And I think that it's good to prepare for how you're going to work with, you know, these other professions. They're not like, you're on the same team. You're on the same team. Your goal is to help patients the best you can. And I think a lot of, you know, in the future, the benefit is that you can say, oh, you know, if you have an acupuncture patient, you're like, I know a great optometrist I went to school with, like, who can get you a great pair of glasses, has good patient care relationships. So that kind of referral power is really helpful too.
Yeah, I was going to add that, excuse me, that, you know, Sam and Emma, you're going to be doing the book club soon this semester, which is another kind of case presentation, interprofessional event. This summer will be the opioid epidemic in IPE, where students will get together and talk about the opioid epidemic and what roles that you can play, which I personally feel our acupuncture students, that is a place to shine. That's the place that you can really talk a lot about acupuncture, because we have such a significant impact on that issue. And then in my course, we have a day where we're just meeting with physical therapy. You know, we're expanding a lot of the other opportunities to work with different disciplines. And then the doctoral program is a roundtable of faculty from the different programs that help students really go in depth as to what are the roles and responsibilities of these professions, and then how can acupuncture work seamlessly with these different professions, especially within a hospital setting. So one of my roles is I work at UMass Memorial Hospital, and we have students coming in through rotations. And once you get into a hospital like that, and we're kind of like hidden, but not hidden. And we're just getting flooded with patients as a result. So you can have, you know, look forward to coming to UMass Clinic Sam and Emma, if you have an interest in treating chronic pain. So.
So not only do we have kind of this interprofessional education where you get to work with other members of the campus, a little bit about what we also have to offer on campus. So when I talk about facilities on any other information session, I keep it very basic. We do have amazing facilities, but the acupuncture building is the nicest, it's the newest, the colors were so carefully picked out, and the way that the light hit, just everything about that building is just very comforting. There's no other building like it on campus. So from a facility standpoint, it is amazing. And it also we have a top of the line, herbal dispensary on campus. We have our own clinic on campus. So and we have some amazing faculty, and a lot of them tend to be very humble. And the more and more I learn from them when they finally tell me things about themselves, the more I am impressed and the more I am amazed. So including Dr. Sina, I'm not saying it just because you're here, but there's just faculty, the more I learn, are just, it's amazing what some of these people are doing in the field. So be very, very lucky that they are your first networks. But we also have everything in terms of having to lead to success of our students. So in terms, you always have a faculty advisor. Your faculty, when they are on campus, their doors are open unless they're in a meeting. They all hold office hours. So you would always have access to them, especially your own faculty advisor. You'll have, clinic advising and all sorts of advising through the program. But we also have academic services. So I think especially when I was an undergrad, when I thought about like tutoring or academic services, it was immediate in my brain of, you're failing, go get help. And it is not like that when it comes to grad school. You are going to be learning a different way. Your life is going to be a whole different work balance, time management. And these programs move fast. So if you're thinking, well, I kind of get it, or I get it enough, it's fine, I'm just gonna move on, maybe go chat with someone in case, because the more prepared you are, the more that you're not gonna have to catch up down the road. And the great thing about it is you're paired with a second year NISA student. So they took those exams, they took those courses with those faculty members, they have their notebooks, they still have their notes. They are such an incredible resource to you. So if you're not finding them like in the lounge in between classes, you definitely can make formal appointments with them. And we also have, plenty of counseling services and career services. But Sam, Emma, I'll let you guys talk about from a student perspective, like the different resources that are available for you all.
Yeah, so one of my favorite resources that I really appreciate is the student peer tutoring. So it's usually with a second year student, but sometimes it's a third year student when you're a first year. And you can set up a session either on Zoom, or if it's more for a practical class, it would be in person. That has been really helpful for me, especially last semester. It's just very different. You're working on bodies a lot. So if you want to just make sure that you're finding the points correctly or finding muscles correctly, you can set up time with a second or third year student who has actually taken the class, passed the class, and knows what they're talking about, and they can help you find the correct points, the correct muscles, which is just really helpful. Also, the Zoom sessions are really helpful for like theory, or if you do just want to go over some points or muscles on Zoom. So that's been super helpful for me. And it's also really nice to establish relationships with the older students too, because we do see them on campus a lot. So that's been fun to kind of create those relationships with them through tutoring. And then you get to talk about what's going on in class and what they like to do and what their goals are. So that's been really great for me. I really enjoy the peer tutoring.
Yeah, I can say all the same things as Sam here. And I think the Zoom tutoring is super helpful. I did at least one session last semester with a second year student who even just ran through the the way the exam was going to be presented in a class for me. Like he just went through, this is how this professor writes his questions. You know, he didn't have all the answers for me, but he had the best way for me to prepare. You know, he had really good advice about, you know, the practical portion of the exam and how, you know, finding your reference points is the most important part. If you can find your reference points, you can find any other points. So, you know, having someone that can just give you, you know, it's great to have the faculty is so open, but, you know, the faculty might not explain something in a way that somebody who took the class and the exam would explain it to you. So having someone who's like, yeah, no, I did this, this, and this, and you go, I never thought of that. That's really helpful. Is awesome. And, you know, I think sometimes it's like making another appointment in person when you're on school or you're in school all day can be too much of an obstacle, but the Zoom sessions are super helpful because you could just get home and, you know, start talking to someone. Yeah.
Amazing. So this also is now going to bring us, we talked a lot about MCPHS. That is a university that we are matched under. But back in 2016 came a point where MCPHS did some things very, very well. You know, we have PA, we had nursing, we had all of, you know, the main Western medical things that you can think of, right? So we are a health science institution. But that's all we had. So we couldn't necessarily say that we provide all health science and healthcare unless we said we only provide Western style health science and healthcare. So with that, we did not have the expertise to launch any kind of Eastern medicine program. But the New England School of Acupuncture did. We had some extra space out here in Worcester. Newton, not as easy to find extra space and expand, you know, physically. We wanted to come together and we wanted a partner that was going to fit our university. So we didn't want just anyone to partner with. We wanted the best, and we wanted a school that fit, you know, how do we view community? You know, how do we value our students? So at first, I think a lot of people were a little weary and like, oh my God, how is this going to work? How are we going to integrate? And I will definitely say, when working in admissions, I was like, oh my God, how am I going to sell these? Someone please give me a little bit more training. I don't know how any of this works. Well, here we are quite a bit later, and it's working amazing. I think it has been such an incredible value to have this piece on campus and to be able to teach other students and show them that, you know, it's not just I put a needle in someone's arm. It's not just sometimes when people have pieces of the information. So I think it's been a really great value to have this partnership. I do have some new statistics that are out for 2024 that we're #1 ranked on a lot of different ways that you look about that. We've been around a very long time. We are the oldest school in the United States for acupuncture. So on the East Coast, I would definitely recommend that this is the place to be. And then again, #2, #1, it's just been a really great, it's been a really great partnership to be able to go back that old and say that these two institutions can really share that kind of heritage. So with that, Dr. Sina, I'm gonna first and foremost, Dr. Sina has been around before the transition. He was a student, he went through these programs. So it's actually the best person to talk to us about mission statements and NISA's purpose.
Yeah, so when you're talking about reluctance on maybe the programs here, I was reluctant to go into MCPHS, having worked with NISA for about 10 years. I'm a 2001 graduate. And I felt, I'm not sure if, you know, adding this integrative medicine, this complementary medicine into a Western university would be a good mix. And I was clearly proven wrong. I have strong sort of professional relationships with the different departments and the people in them, serving on the interprofessional education committees. I do work now also with other programs, whether they're looking for new deans or serving on the student experience strategic planning board. So I can say that Nice has never been better, having known it for all these years and been involved, that we're strong and we're growing. Whereas you can't really say that about other schools right now. And those are any standalone school that exists in some ways, regardless of whether they're a Chinese medicine school or not. So yeah, I think, working within our community, which is very important to my colleagues and hopefully for the students as well, that, we want to support each other and send out the next, level of contemporary acupuncturists, which involves not only a deep understanding of Chinese medicine, but also an understanding of how to work within the healthcare system and understand, biomedical approaches. And yeah, I can't, obviously I'm the biased one. You could talk to the students more about that.
That's okay. You can be a little biased. You've earned it. So for some of us that there's all different levels of inquiries I get. We get some students that have just stumbled upon acupuncture and maybe don't know a whole lot about what entails into a career in there. Sometimes I have students at an advising appointment this morning that they were so incredibly well prepared. They knew more than I did, and they were very excited. So very much different various, you could be coming from different points of interest. So Dr. Sina, would you like to kind of go over the foundation and the basics of what students are learning in these programs?
Yeah, so what you see here are the pillars of Chinese medicine: acupuncture, Chinese herbs, nutrition, Asian body work. These are all the pillars of what make up Chinese medicine, as well as, movement therapy, which is something like Qigong or Tai Chi. And so students are going to be heavily trained the most on things like acupuncture and herbal medicine. Our herbal students will really be working probably 80% of their work in that third year on understanding how to apply Chinese medicine or Chinese herbs to lots of different kinds of conditions. And when I talk to people about Chinese medicine, it's a different way of thinking about the body and its existence in the environment, is a good way to explain it. It's a holistic medicine where you're taking information from tongue and pulse diagnosis, as well as the information that the patient is telling you. You're plugging it into our system, and that'll help you to create the diagnosis as well as the treatment approach using acupuncture, herbs, and a variety of acupuncture techniques, such as like burning this herb on the end of a needle called moxibustion, cupping therapy, gua sha is a scraping therapy, electroacupuncture. We teach some other methods like kinesiotaping and Twain mobilization technique, and all sorts of other things that make it the complete medical system that it is. And so when our students go to IPE, it's kind of, what don't you treat? Well, it's a complete medical system. So you pretty much treat absolutely everything. So you can't really say, it's particularly focused in one area or not. And the majority of what patients end up coming in for are for pain. And so that's why we have a lot of information on how to train and be really effective at treating pain.
And I will say that I went to the community clinic and a third year student cured my pain. So I was definitely convinced. I got off the table and I was like, it's like magic. And she goes, please don't refer to it as magic. I was like, but it felt like that. So definitely helps. So we have some options here. We have our master's level programs. We also have doctorate bridge programs or master's to doctorate pathways. So if you want to be practicing acupuncture and you want to be a clinician, you have to go through a master of acupuncture. That is the that's the basis for you to get there. So if you successfully complete a master's of acupuncture, it makes you eligible to sit for the exam to be a licensed practitioner. Great. We also have the Master of Acupuncture in Chinese Herbal Medicine. So not only would you be eligible to be licensed as an acupuncturist, you would also be able to work with herbs and administer them to your patients. So those are two really great options depending on what state you're going to be licensed in. You may have to have both herbs in acupuncture. So someone correct me if I'm wrong, that is not the case here in Massachusetts.
That's right. Yeah, you
Okay,
don't need
good.
herbs in Massachusetts.
Perfect. I knew that one. But if you're looking at states like Florida or California, even New Hampshire, you do want to make sure that you look at what is accepted and what the rules per state may be. So that could vary a little bit. We also have ways for you to go on to the doctoral program. So for students, you can do the whole thing. You could do acupuncture, you could do herbs, we could do the doctorate, or we can kind of pick and choose. You could, for now, if you wanted to stop at the master's, right now we do offer a bridge. It's a 1-year doctoral completion program. I definitely see the industry moving kind of like physical therapy. I think that we're going to see a day where it's no longer a master's degree, but it is going to be a doctorate degree to be required to practice. That is not the case right now. So you don't necessarily have to worry about that right now where you're looking, but I do recommend to students, if you think that the doctorate is something you want to pursue, apply for it from the beginning. It is so much easier at this university to drop something than it is to add on. I don't know if that's the same thing at every university. We just happen to be notorious for it. And it doesn't change the admission process. You don't start taking anything regarding the doctorate program until you're finished with the master's program. So you have until that final year to drop it if you chose to. You also, I will say, you get intro to herbs your first year. You also get intro to this concentration of Japanese acupuncture. So even from the start, if you're still weary about it, but then you take these introduction courses, you could add it on to your pathway. So Dr. Sina, I'm gonna have you tell us a little bit about maybe the difference in just getting acupuncture and with herbs and the benefit of moving on to your doctor. And then students, I'm going to have you talk about the pathways you guys are traveling down.
Yeah, I'll talk quickly, so that they get a chance to talk. So I have training in herbal medicine, and so I'm biased in that way again. I think the herbal medicine, where acupuncture creates the state in the body for the body to heal itself, adding herbs really adds that extra component, that gasoline, to really make that healing process work better and faster a lot of times. And the doctoral program is really meant to deeply train you in becoming the leaders of I believe, the leaders of the profession, the ones that can work best in hospital settings, the one that can speak the language of Western medicine well, and the ones that are very well trained on interprofessional communication. Not that you don't get that in the program, in the graduate program, it's just heavily emphasized in the doctoral program. Yeah, I guess that's the majority of it. I'll let the others talk.
All right, so I am currently on the Doctor of Acupuncture with the Japanese acupuncture track. So I'm not currently signed up for herbs. That may change. I didn't come in with it, but maybe I'll be convinced. We're taking our first class right now, so I'm kind of just seeing how it is. And then I might add it on, but we'll see. I'm definitely going to do Japanese acupuncture completion track. And then I did decide to go ahead and just sign up for the Doctor of Acupuncture track from the start, because I knew that that would be something I'd want to do eventually. And like Amy said, it's just easier to go ahead and add it on. I think I will say, from what I have experienced right now, like Amy said, easier to sign up for something than add it on later. I think I'm giving myself a little bit too much leeway about the track with herbs right now. So if I had just come in with that herbs, I would be doing it no problem, but I'm kind of waffling right now. So I would say, if you're at all a little bit interested in herbs, maybe just from the start, go ahead and sign up for that. And then you can always say, it's something I don't want to do, I'm going to take it off my plate, but it is harder to add it on, I would say. So I'm happy right now with the jazz track, and then thinking about the herb track, but the acupuncture track all around is really complete. So I feel like I'm going to get a good education no matter what I choose.
Yeah, so I am currently signed up for the MAC-CHIM program, which is what they sort of mash the consonants together there, and it's MAC-CHIM. But there's a vowel in there. But and the doctoral program, that may change. I feel like this semester, as we're getting sort of closer to regular practice, I am really like chomping at the bit to get into practice and take my boards when the time comes. So, it may change, but I will say any changes I've had to do so far have been very easy. And I know, I think, Amy's totally right. Just add it on. If you're not sure, you have plenty of time to take it off. And I think waiting until you sort of get a taste of something before you decide that would be too much or that's not interesting to me. But I also think that, Steve kind of talked about this earlier, that, there are pillars of Chinese medicine, and herbal medicine is one of the pillars. So even if you are not interested in it, it behooves you to understand it and to, luckily you will have lots of classmates who are super interested in it. I think like I'm watching the third years, there's definitely like herbal students who are like super into it and that's what they do. And you could go to them and ask them what they think about something. But I think every practitioner, especially when you start to meet practitioners in the wild and see how they choose to treat their patients, you find the specialty that interests you the most, that you're passionate about, and that you do the best. Like, because you're so interested and passionate, you do the best in them. So I don't think you can go wrong with any program you choose. Here, like Sam said, it's super well-rounded no matter what. Even if you're not doing herbs, it's very well-rounded and you get a taste of the herbs. And you can't like leave clinic without witnessing some of it. There's lots of prescriptions going up to the second floor and down. And so there's really no wrong way to do it. And if you're nervous, add it on and take it off when you've had a taste and you decide you don't like it.
Sam, we have a question for you. What drew you to the Japanese concentration, and how different or similar is it to how you would practice traditional Chinese medicine?
Okay. Yeah, good question. So I actually found my calling to this school through a Japanese acupuncturist. So I was receiving Japanese acupuncture treatments, healed me through and through, and I was like, if I can do this, that would be an amazing life. So found NISA, and then my Japanese practitioner actually used to work at NISA, Megan Mead. So she came through the program as well. So she kind of also encouraged me to check it out and, see what it was about. It is very similar to traditional Chinese medicine. A lot of the same points, a lot of the same questions that we'd be asking patients and theories, but it's a little bit more, there are different ways of diagnosing. So that's one of the main things. So with traditional Chinese medicine, you're looking at the tongue and you're taking one pulse on one arm at a time. With Japanese medicine, you're taking 2 arm pulses at a time and you're palpating the abdomen. You don't look at the tongue at all. So that's a little bit different. And then Japanese treatment tends to be a bit shallower, and it's good for people with weaker constitutions, maybe children who are more sensitive, maybe elderly people who are more needle sensitive. So you're not needling as deep, maybe you're not doing as much gua sha, you're doing more like palpating channels. So I wouldn't say that it's necessarily like a gentler technique, but the techniques that we are learning right now in our Japanese class are a little bit shallower, I would say. I guess like they're a little bit more, the needles don't go in as deep and you're not pressing as hard, I would say. So I just have a background with it. That's why I decided to add it on. I think what I have seen from a lot of practitioners is that a lot of them do have TCM and jazz, so they can kind of go between the two. I think it's a little bit more rare to see someone be strictly TCM and strictly jazz, and maybe that's just my experience, but I find that it's a really interesting practice, and kind of like we've been talking about, while you're here, why not learn it all? So that's also why I wanted to add on the concentration.
Okay, so this is honestly like the part. I feel like everyone's waiting for this part. Like, what do I get to do? Where do I get to go? How am I changing the world? So, your clinical training here at NISA is broken up into 2 phases. So, you will first be doing a clinical assistantship. So, this is more shadowing, observing, working alongside. And then as we move further into the program, you'll be doing your clinical internships. So, this is where you are administering the acupuncture under direct supervision. So we start off, I mean, obviously, just like we start off in the program, right? We start with a Lyme. We don't start with human beings. We start with you assisting and shadowing and practicing before we're going to throw you out there. So Dr. Sina, I'm going to have you talk about some of these locations we have and opportunities we have. And Sam and Emma, if you guys kind of want to talk about, I know you haven't had too much going on yet, but so far your experience with clinical.
Yeah, so Sam and Emma are doing their assistantship hours now, shadowing. And are you on, you might be both on campus, but you can certainly shadow you're off campus, great. So there are 90 private acupuncture practices associated with the school that you can go out to and sort of shadow their practice. If you know of an acupuncturist, sometimes we'll just roll them into the private acupuncture practices that we have. Just take some paperwork, and then you can shadow with your acupuncturist if they are willing to have you do that. Second phase is clinical internship. So at the end of the second year, you're starting to treat patients. And I will say by then, sure, you're a little nervous to start because you're going to see actual patients, but you're ready to start. You're going to get enough training by then. As Amy was saying, you're needling pretty much right away. That's really important. Gets you really comfortable with the acupuncture. And so that when you get into clinic, you're really just figuring out how you want to flow and be, and you're under direct supervision. So, there's always a faculty member there to support and assist you with that. Here are the different centers that you see listed on here, and they're continuing to expand. I have to go Friday. We're going to Clinton Hospital up in Fitchburg, where we're going to start an oncology clinic in a beautiful wellness center that they just built out. And so it's part of the UMass Medical Center family. And then we're also looking for the UMass, I'm at family medicine at the moment, which is focused on pain, but we're looking at university campus as well. So it just keeps developing more and more. I also know that Veterans Inc. is going to add acupuncture. So those are the things that aren't on the list, but are continuing to expand and develop. But yeah, I'll let the students talk to you a little bit about their experience in shadowing.
Sure, I can start. Yeah, so this semester we've just started, shadowing private practices. I think there are some people who are maybe doing hospital rotation. I think it takes a little extra paperwork to do a hospital rotation, so there's some planning, but we have a really great, sort of head of clinical that helps manage all of that, who is super organized. I don't know how she does it. The way she schedules things is crazy. I think she has a son that's really good at like computer scheduling, because she's like a wizard. It's amazing. But so before I started at NISA, I actually sort of assisted a NISA grad who I was just trying to figure out if I liked it or not. And the way she worked was just amazing. And, patients would lift off the table and say, Amy cured me. And I would be like, wow, okay. So, witnessing that again, now that I sort of understand the medicine better, has been really cool. I've started shadowing a private practice in Andover. And that's the other thing, is you can find somebody that's really close to where, if you're a commuter, you can find someone that's close to where you live. They have a really vast network. And like Dr. Sina said, like you can add people to the network if you have someone, if you know of a practitioner who you really like. You can, if they're interested, they can start taking assistance as well. And the really good practitioners will get you right into it. I was doing gua sha on patients last week. And like, Amy said, we sort of start really quickly needling. it's a little bit intimidating when you get into it, but you get started on it so quickly and you do it so often that, and witnessing the third year students. So your first semester, you're watching third year students down in the clinic and they're just boop, 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 boop. It's quick. It's really graceful. And you're like, okay, I will be ready by that point. So that's what I've appreciated the most is I think there's so much theory behind this medicine and you could get lost all day behind a book or a screen, but getting into it and witnessing it work and witnessing someone solve a puzzle of the different, patterns of deficiency and excess in a body is like the most important thing. And NISA really throws you right into that instantly, which I've loved so far.
Yeah, just kind of building off of what Emma was just saying, I think it's been a really amazing, almost, I don't know what the right metaphor is, like domino effect to watch, but you kind of come in as your first year and you go down and you shadow the interns in the clinic and you're like, how am I going to be doing that in 2 years? No way. Like, that's crazy. They're wizards. And then you kind of get more into the program and you start to have a better grasp on the theory and on the points. And then this semester we're out in the practices shadowing people who have been treating for 25 years, like people who are really experienced, and they are even more wizard-like. So you just kind of keep seeing how like this is how your career is going to progress. And it's really amazing to put yourself in that position to just like go with it and kind of trust the process, I guess, that you're going to be okay learning the theory this first year. And then by the time you're third year, you'll be treating, you'll be very confident in that. And then you'll have a really long, successful career. Well, you'll get to a point, and the people that we're shadow or assisting right now, like, have such great rapport with their patients. They know exactly what points to do based on just how people talk to them. Like, their methods are very different. They're very experienced, very studied. So it's just really cool to see how your career is going to progress through this shadowing program.
So we've also talked a lot about herbs, right? We have an herb track. I've talked about how we have this state-of-the-art herb dispensary. So Dr. Steiner, do you want to talk to us a little bit about what is the dispensary? What do we do there? And Emma, if you'd like to chime in, since you are on the herb track, of maybe what, I know you haven't done a whole lot yet, but maybe so far of what you've experienced in terms of herbs.
Yeah, it looks like that's a new picture because that's May on the right, scanning some herbs, and that's Medora, the dispensary manager. And so she's in the main room, May's in the powdered room. So those are powdered herbs that are concentrates that she's sort of logging in there that she probably created for a patient down in the clinic. Medora's over there in the raw herb formula room. And the dispensary can create pretty much anything you need, from tablets to capsules to decoctions, in the sense of putting together the herbs that you could boil and drink as a liquid. Most of the time people like the concentrated because it's so easy. You just take the scoops that you need, and then you take them throughout the day. So yeah, it's a very long-standing herbal dispensary that we've had. And I would say with Medora's guidance too, if you don't know Medora, yeah, you'll end up loving Medora. So she's, especially if you're in the herbal program, she's like the mother, the mother figure. And she also runs clinics and does that kind of thing. But I'll let Emma talk about her experiences.
Yeah, so Sam and I are both in Intro to Herbs right now, and we actually just had our first hands-on project where part of it involved an herbal tasting in the dispensary, which was super cool. So you sort of learn the tastes of the herbs and how they impact different organs, how they get to different organs based on the flavor, because you will learn every organ has a taste and a smell and all these different things, a color associated. So it's fascinating to sort of see these things, how they're used practically, because I think that's a very ethereal concept for a lot of Western people. But to see, okay, it's a bitter herb, it goes to the heart. That we would use this herb with someone with a heart condition or a weak heart constitution, that kind of thing. So getting to taste those, and then we got to pick an herb and use a method called Pausure, which is cooking the herb in a certain way. So my Pausure method was called Measure, which is frying it in honey So I took half the herb, left it raw, and decocted that, and then measured the other half, and decocted that, and sort of observed the differences in how it tasted, how concentrated it was. And it was amazing, the difference between the two herbs, even though they were the same herb. So I did astragalus, which is something I have been self-medicating with for 10 years now. So to see it raw and to work with it was really cool. There's definitely an empowerment that I feel about the herbal program, that like, I could take these things and make, Medora is great because she does she have alpacas? Yeah, she made her alpacas eye drops for a condition, with Chinese herbs. So like she'll tell you like, oh, I saved my guinea pig last week with some herbs, or like, so like you're like, how did you do that? And she's like, well, it was presenting like this, and then I used these herbs. And you're like, okay, so will I ever get to that? And you will, at some point. But it's interesting this early on, seeing that there is a direct application in your life, that you can take the herbs and run with. So.
And that's just from intro to herbs. Everyone's going to get experiences like this, which is great that everyone has at least an introduction and knows what's going on, even if you're not following the path. We have talked a lot about why to come study at NISA, why this is a great program. So what I want from this slide is, Sam and Emma, I want you to just tell us, why did you decide to study at NISA?
Yeah, so for me, actually, a big part of it was the opportunity to be in a bigger campus with other professions. So MCPHS as a whole, I worked before coming here at a multidisciplinary clinic with like chiropractors, physical therapists, acupuncturists, massage therapists. So I kind of saw how they all saw the same patients for similar issues, and all were working together to treat that one person. And I really liked that. And so seeing a university that had that same mentality was really important to me. And then also just NISA has really amazing faculty, really great curriculum. And it was one of the places that just felt like I could see myself there when I came and did the campus tour. When I spoke to some of the faculty and some graduate students, I just felt like this was a community that I could really see myself being at, feeling comfortable at, and after graduation, being a part of that alumni network. So it just kind of seemed like this was the fit for me.
Yeah, for me, it was a location convenience was definitely a big part of it, but also, it's the oldest school in the country. I mean, I think that speaks for itself. In, the alumni network is massive. I mean, even from the posts on Facebook, you can see, oh, I was at NISA 25 years ago. I was at NISA 30 years ago. So I think that's been a big part of it too, is just, the age of NISA plus the, prestige of MCPHS is a really synergistic combo, and really helpful if you're at all, sort of nervous about how, especially I did not come from any type of medical background. I was a project manager in technology and I didn't like it. So, I was sort of struggling to figure out what I wanted to do next. And I had a friend of a friend who said, hey, come shadow me, come see how it goes. And I loved it. And she had graduated from NISA in 2013. So, she was like, yeah, this is what I did. And here's, if I had to do it again, here's what I would do differently. So I had, a network. And, then all of a sudden my uncle was like, yeah, one of our good friends was the dean at NISA for a while. And I was like, okay, so that was there's been sort of, you can sort of find some connection to NISA in everyone you talk to. It's like 7 degrees of separation. It's crazy. But, and I have my best friend from childhood is an ER nurse. And I told her I was going to MCPHS, and she was like, oh, that's a fantastic school for, nursing. So there's a lot of prestige in the name of MCPHS. And then that plus, the age and, quality of the education at NISA has been really comprehensive and helpful, and makes me feel more confident in, what I'm talking about.
Emma, you didn't even name drop through the admission process. That's the first
No,
time
why
I've
would I
heard
do
that.
that?
Which you didn't have to,
Oh,
but I'm
it's a
always
friend
learning
of my
something
uncle.
new.
Like a friend of my uncle. That's not really droppy.
That's okay. That's okay. We get it all the time. So we have talked a lot about, again, why to come here. We're in a field of growth, not only in healthcare, but acupuncture in general. So I do know things are on the rise, and things are on the rise in the area of acupuncture, but things are also big on the rise for NISA. So this is actually, we're celebrating 50 years, we're expanding. We're going to have a presence in Boston soon. We're doing that in small increments. There are no programs there yet, but down the line, that is the goal eventually. So Dr. Sina, do you want to just talk a little bit here about alumni? You are an alumni, but kind of where they're going, what they're doing.
Where they're going, what they're doing is they're all over the place. They are, as I think Emma and Sam were saying, if they've come to NISA, they're definitely in the New England area. But I know some that have traveled to Hawaii. They're practicing in Hawaii. They're practicing in the UK, and they're kind of all over the world. A lot of them, and being the first school of acupuncture, Dr. So was the founding father of acupuncture in the United States, and so he was the one who started the school, back those 50 years ago. So, yeah, I think we have that rich history, and the alumni network. One thing we do is, if you go to our Facebook page, which I manage some of it, is I put up some of the job postings there, and it's just like, after a while, I'm like, another job posting. It doesn't really have to be that many. But yeah, we have a lot of job postings, especially in the New England area, and people who sell their practices, and whatever the case may be. You can go online and check that out. And yeah, and looking at the stats here, the profession is growing, and I think Bureau of Labor Statistics, I think they even upgraded the amount that acupuncturists are making
Oh yeah,
annually.
that is the amount. I forgot to change the year. It's the
That's all right.
correct
No,
amount. I just have to put in
okay.
2024.
Yeah, yes, and it seems like it used to take 3 to 5 years to establish a practice. Now it feels like 1 or 2 students are hitting the ground. And then I hear students are like, Steve, can you post an ad for, I'm looking to hire another acupuncturist. So I'm like, didn't you just graduate? Like, what's going on? Like I came from the old days where you had to, walk uphill both ways, that kind of situation. But, still very successful. Yeah.
There is definitely a need for acupuncturists. My local acupuncturist needs help. He has a waiting list. Our clinic has a waiting list. So we absolutely need more in the profession. So if anyone is ready to apply now, it's actually a free application through our website. So if you go to any of our graduate apply now buttons, it's the MCPHS graduate application. You would fill out the basic form. Who are you? Where have you been? What are you doing? There's also a personal statement, your journey to acupuncture. So not too much, not a hard question, although sometimes you do have to think about what you're going to say. And then there'll be some instructions on how to submit your official transcripts to us. So if you are thinking about coming in terms of eligibility, we do not have any course requirements. So we have credit requirements. If you have completed an undergraduate degree, you're eligible for both master's and doctorate. If you have not completed an undergraduate degree, in order to proceed to the Master of Acupuncture, you would need to show at least 60 undergraduate credits completed. And if you wanted to follow through to the doctorate program, you would have to show at least 90 undergraduate college credits completed. So keep that in mind in terms of where, long-term plans are going to be. But there's no specific courses that we're going to be looking for or judging those specific grades to be coming in. If you are an international applicant, we do require transcripts to be evaluated. You can use WES or ECE. I know other people are also using Spantran and some other different vendors. Once you finish your application, it is first going to come to me when you submit it and it's completed. I am making sure that if you attended Harvard University for your undergraduate degree, that transcript actually is coming from Harvard and you are who you say you are. we're double checking criminal records, or if there's anything we may have to look further to in detail. I'm making sure you're an eligible candidate to be applying to the program. So that's kind of my first review. If you are an eligible candidate, then we would invite you for your interview. So you could be lucky enough to be interviewing with Dr. Sina, who does both on-campus and online interviews. It's one-on-one. It's not a panel of your judges with a big red pen. So don't be nervous about that. It's about a half an hour. And like I said, you can do it on campus, you can do it online, and you typically have your final decision within a week. We say 2 weeks maximum, but in a week. Poor Sam, in her case, her application got dredged to the system and kicked out and had to be fixed. But normally we try to have this a smooth process, and it goes through in about a week. Preparing for your interview, we love questions. We want also asking questions is a way to show your interest in the field. So when I say that, it's not just because faculty members, want to talk about themselves or listen to their own voice. It's really a way of what are your questions and how interested are you in the program. So don't think of it as a negative. It definitely is a positive. And really be yourself. That is the point of this interview. If you're not yourself, we may not know, well, they acted this way and they seem like they'd be a great fit. Then they get here and it's like, well, that's not necessarily maybe how they portrayed themselves on the interview. Just be you. We know when someone is being, true to themselves. Don't be nervous. This is a great time for us. Not only, yes, we want to get to know more about you, but we want to make sure you know everything about us and make sure that you feel comfortable with us. Not only do we feel comfortable with you. So that's really the main points of in terms of review of your applications and admission. I will say, so the interview portion happens. There are some frequently asked questions up here. I know we're over time, so obviously if you do have last minute questions, feel free to drop them in the chat. But after the interview, like I said, you get your decision within a week. You do get a 30-day deposit window. If you needed more time, you just let me know. And then we kind of go from there. So once we have your application and we can lock you in for interview, it's a pretty quick process from there on out. We do have some flexible enrollment options. For the Master of Acupuncture, we have our standard program, which is 3 years in length. And then we have our extended program, which would be 4 years in length. So if you are doing our extended program, it's a little bit less coursework on the front end. So instead of taking the first year of curriculum, you'll take 2 years to complete that first year of curriculum. So we separate it out and we slow it down a little bit. But keep in mind, when you're coming on for the finishing years, it's full time and it's going to be very quick. So I do warn students that it is going to be a transition if you're doing the extended program, but we do have students that are in it. So definitely a good option if that works better for your schedules. Hybrid really during that first year is kind of where we're offering a lot of that more flexibility. Students are typically on campus 3 days a week. They could be taking, lectures on Monday from home. They don't necessarily need to be physically on campus. So we do offer a lot of those lectures in a hybrid format, but we do not have a fully hybrid or a fully part-time program. All of our master's programs start in the fall. We talked a little bit about not having to have a specific background. If you are an international student, yes, we want to encourage you to apply. We do take transfer credit. If you have taken general biology, anatomy and physiology 1 or anatomy and physiology 2, and within the past 5 years, we could take it as transfer credit. Or if you are working currently as a nurse or another kind of clinical practitioner, we can take that under consideration. If maybe it's been more than 5 years since you've taken some of those courses. But we could deal with that always on a case-by-case basis. We do process federal financial aid. So if you are a domestic applicant, please fill out your FAFSA to know what kind of financial aid package might be available for you. And we do have scholarships. We are working on the final scholarship package for fall of 2025. We actually just moved our billing structure to a per credit billing, so we can keep it, especially if students are doing extended programs or standard programs. This is a way to keep billing a little bit more even. So before it was a per year scholarship, we are moving to a per credit scholarship to basically reflect the same type of scholarship you're receiving. It's just going to look a little different when you receive it in the letter. And one big thing I do like to point out, because I get a lot of questions of, well, I want to go practice in Texas. Like, what are the requirements for that? I have no idea. Like I said, I'm pretty familiar with Massachusetts, but you can very much go online, double check the state you want to practice in, even maybe before you're applying, so you know, okay, can I just do acupuncture? Do I need acupuncture and herbs? That's definitely something I recommend checking out when you're thinking about going to acupuncture school. Oops, sorry, I wanted that slide up. I don't see any more questions coming in, but my information is here. Please come visit us. If you'd like a campus tour, we have these two amazing admission ambassadors that are going to tour you around campus. They're teaching me things, and I've been doing this for a while, so it's amazing. We have virtual opportunities, so if you wanted to chat with a student or email or by phone call, or maybe with a faculty member, I'm happy to set that up. And we have some great YouTube footage online, and if you can't physically make it here in campus. So I don't see any more questions coming in, and I know that I went a little bit